11 signs of a stroke you should never ignore. Understand what happened to Pope Francis. What if in just 5 minutes your life changed forever? What would happen if the clock started counting down to save your brain at this very moment? Would you recognize the signs that could separate a full life from an existence of permanent limitations? Cerebrovascular accident, popularly known as stroke, is the second cause of death in the world and the first cause of permanent disability. Every 6 seconds, a person dies from this devastating condition that does not discriminate against age, gender, or social class. We all know someone who has been affected by this silent disease that destroys neurons at an alarming rate. The knowledge you'll acquire in the next few minutes can literally save a life, maybe your own. When Pope Francis presented with subtle symptoms during an audience, quick identification by his personal medical team was crucial. This same attention to detail is now at your fingertips through information that many neurologists would like everyone to know. Studies show that recognizing the early signs can increase the chances of full recovery by up to 85%. Let's get started. 1. The face that freezes without warning. The face mask of imminent danger. One side of the face suddenly loses its expressiveness, as if it had been carved in stone. This phenomenon happens when specific areas of the brain responsible for facial muscle control are deprived of oxygen. Imagine being conversing normally when, without any warning, half of your face simply stops responding to your commands. The mouth falls to one side, the smile becomes crooked, and the eyelid may drooping like a partially closed curtain. This is the most visible and recognizable sign of a stroke happening at that very moment. Neurologists explain that facial control in the brain is divided into hemispheres. Each side controls the opposite side of the face. When one hemisphere suffers damage, the opposite side of the face loses its ability to move. This sudden facial asymmetry is so characteristic that doctors consider it one of the most reliable signs for immediate diagnosis. Try this quiz right now. Smile in front of the mirror and notice if both sides of your face move symmetrically. Sources close to the Vatican revealed that aides noticed a slight drop in the right corner of the Pope's mouth during a conversation. This close observation was the first clue that led to the quick medical intervention that potentially saved his life. If you notice this asymmetry in someone, immediately ask them to try to smile. The difference between the sides will be evident. Experts warn that many people try to massage their face to regain sensitivity, losing precious minutes. What would you do if you noticed your partially paralyzed face when you look in the mirror during your morning brushing? 2. Imprisoned language, when words get lost along the way. The words are clear in your mind, but they come out scrambled or incomprehensible when you try to pronounce them. This terrifying phenomenon, called aphasia, occurs when the language areas in the brain are damaged by stroke. Imagine trying to ask for help and discovering that your mouth produces sounds that even you don't recognize as real words. To the people around you, it may seem like you're speaking another language, or that you're confused for no apparent reason. Aphasia occurs in approximately 25% of stroke cases and can range from mild to severe. In mild cases, the person may only change a few words or have difficulty finding specific terms. In severe cases, the entire ability to communicate can be compromised, creating desperate isolation. The frustration of knowing exactly what you want to say, but not being able to express it, is described as a mental prison by survivors. During the Pope Francis episode, aides noted unusual hesitation in his words and difficulty completing sentences. His medical team immediately recognized this pattern as a potential sign of acute neurological impairment. Aphasia can also affect comprehension, causing the person to hear familiar words as if they were from an unknown language. If you notice someone with suddenly slurred speech, scrambled words, or completely incoherent, don't hesitate to seek help. This signal is so important that it is part of the acronym SAMU, used worldwide for rapid identification of strokes in progress. Could you tell the difference between someone confused by fatigue and someone suffering from a stroke in progress? 3. Sudden visual fog, the world that disappears before your eyes. Suddenly, Part of your visual field simply disappears, as if someone had erased that portion of the world. This partial and sudden blindness happens when areas responsible for vision in the occipital lobe are deprived of oxygenated blood. Many patients describe it as a dark curtain that descends over part of the vision without any warning. The phenomenon is particularly disorienting because the brain tries to compensate, causing the person not to immediately notice the problem. In some cases, vision does not disappear completely, but becomes distorted, blurry, or fragmented in one or both eyes. Visual loss during a stroke is different from common vision problems. It happens dramatically, in a matter of seconds. Some patients report seeing only half of the objects or losing specific parts of their visual field, as if they were wearing broken glasses. This sudden visual change is one of the most alarming signs your body emits when the brain's blood supply is compromised. Reports indicate that Pope Francis mentioned seeing flashes of light and shadows in his visual field hours before hospitalization. Sudden double vision, or diplopia, is another visual manifestation of stroke that occurs when the nerves that control the eye muscles are affected. Approximately 30% of stroke patients have some type of visual disturbance as one of the first symptoms. If you or someone close to you experiences sudden visual changes accompanied by other symptoms, every minute of waiting costs neurons. A simple test: cover one eye at a time and make sure you can see clearly in all directions with each eye individually. What would you think if half the world in front of you just disappeared during your most important work meeting? 4. The off-balance stance. When the ground seems to move under your feet, your steps become unstable, as if the ground is constantly tilting or undulating under your feet. This sudden imbalance is a critical sign of stroke, especially when it affects the cerebellum or other structures responsible for coordination. The sensation is described by patients as riding in a boat during a storm, even when on dry land. To outside observers, the person appears to be staggering, as if under the influence of alcohol, even though he has not consumed any substance. Many report a pulling sensation to a specific side, as if an invisible magnet is pulling their body in one direction. This instability can range from a slight difficulty walking in a straight line to the complete inability to stand without support. Imbalance during a stroke is often accompanied by severe dizziness, which does not improve when sitting or lying down. The sudden inability to coordinate basic movements that we perform automatically since childhood is one of the most visible indicators of stroke. Vatican sources reported that Pope Francis was hesitant when walking and needed more support than usual during his travels. A simple test known to health professionals is to ask the person to extend their arms in front of them with their eyes closed. If an arm drops or deviates significantly to one side, this may indicate ongoing neurologic impairment. The symptom is particularly dangerous because it dramatically increases the risk of falls, which can cause additional injuries. In older people, this sign is often mistaken for orthopedic problems or age-related weakness. What would you do if, when you get out of bed in the morning, you find that you can no longer walk straight to the bathroom? 5. The cranial explosion, the headache that announces disaster. A devastating headache comes up like thunder, reaching maximum intensity in seconds, not minutes or hours. This is no ordinary pain. Patients often describe it as the worst headache of their lives, without any exaggeration. It is especially characteristic in hemorrhagic strokes, when a blood vessel ruptures and blood leaks into brain tissue. The intensity is so overwhelming that many patients report immediate nausea, extreme sensitivity to light, and sounds. Unlike migraines or tension pain, which usually increase gradually, stroke pain reaches its peak almost instantly. This devastating pain often focuses on a specific region of the head, indicating precisely where the bleeding is occurring. In some cases, the pain can radiate to the neck, causing intense stiffness that makes it difficult to move the head in any direction. The dramatic intensity of this headache is a desperate cry from the brain, signaling that it is being deprived of vital oxygen. Close aides reported that Pope Francis mentioned an unusual pain and pressure on the head before being taken in for observation. Approximately 40% of hemorrhagic stroke patients experience this characteristic pain as their first symptom. Common pain relievers usually have little or no effect on this specific pain. Another important warning sign. If you or someone close to you experiences a sudden and extreme headache with no apparent cause, always consider the possibility of a stroke. Studies show that women are more likely to report severe headache during a stroke than men. Would you know how to differentiate between a common headache and one that could signal a potentially life-threatening medical emergency? 6. The mind that is lost. Mental confusion and sudden disorientation. Suddenly, you don't know where you are, how you got there, or even what day it is. This acute mental confusion occurs when areas of the brain responsible for cognition and orientation do not receive enough oxygen. Thinking becomes hazy, like trying to see through fogged glass or thinking under the effect of deep sedation. Simple questions like, "What's your full name?" or "What year is it?" become surprisingly difficult to answer. For family members, this change is particularly alarming. The person appears physically normal, but mentally absent. In severe cases, the disorientation can be so severe that the patient does not recognize close people or familiar places. Many describe the sensation as being in a dream or having the feeling of disconnection from the reality around you. This sudden mental fog isn't just common confusion. It's a sure sign that crucial areas of the brain are being damaged at that time. Vatican sources indicated that Pope Francis presented moments of mild confusion during conversations, briefly losing the thread of reasoning. A simple test used by doctors is to ask the person to say their full name, where they are, and the current date, including the year. This confusion is particularly dangerous because it can prevent the person from recognizing that something is wrong and seeking help. Abrupt changes in behavior, such as agitation in someone normally calm or apathy in someone typically excited, are also important signs. In the elderly, this symptom is often mistaken for dementia or age-related confusion, delaying vital treatment. How would you react if, for a few moments, you couldn't remember your own name or address during a casual conversation? 7. The stomach revolution, nausea and vomiting as neurological sentinels. Severe nausea occurs without warning, often followed by vomiting that is unrelated to food eaten. This seemingly unconnected digestive symptom can be a crucial sign of stroke, especially those affecting the brainstem. Many people waste precious time looking for gastrointestinal causes when the problem is actually in the central nervous system. Nausea from a stroke is different from that caused by food poisoning. It persists regardless of diet or medication. This sign is particularly common in posterior circulation strokes, a variant that affects the back of the brain. When certain areas of the cerebellum are affected, the vomiting control center in the brainstem may be inadvertently activated. In some cases, vomiting is so severe and persistent that it causes dehydration quickly, further complicating the clinical picture. The combination of sudden nausea with severe dizziness and difficulty balancing forms a triad that should trigger immediate alarms. Medical sources confirmed that Pope Francis experienced unusual stomach upset in the hours leading up to his hospitalization. Nausea during a stroke is often accompanied by cold sweating, extreme pallor, and sensitivity to light. Studies show that approximately 25% of stroke patients in the cerebellum have nausea and vomiting as initial symptoms. This sign is often more prominent in women, leading to misdiagnoses such as migraine or labyrinthitis. The persistence of digestive symptoms even after antiemetic medication can be an important clue to the correct diagnosis. What would you think if you experienced sudden intense nausea, along with tingling in your arm and difficulty speaking clearly? 8. The paralyzed body. The one-sided weakness that reveals the brain in danger. Suddenly, an arm or leg, or both on the same side, loses strength as if they had been disconnected from their command. This unilateral weakness, called hemiparesis, is one of the most characteristic and recognizable signs of an ongoing ischemic stroke. The symptom occurs because each brain hemisphere controls the opposite side of the body. Damage to the left side of the brain affects the right side of the body. The severity can range from mild difficulty holding objects to complete paralysis on one side of the body. Many patients describe the sensation as if the arm belongs to someone else, or as if it is asleep and heavy as lead. A simple and effective test is to ask the person to raise both arms to shoulder height and hold them elevated for 10 seconds. If an arm falls or drifts downward involuntarily, this is a clear sign of acute neurological weakness. This sudden loss of strength in half of the body is literally the brain screaming for help before permanent damage occurs. Close aides reported that Pope Francis had difficulty holding objects with his left hand before being hospitalized. Weakness can subtly affect the face along with the limbs, creating the classic drooping face on one side. Approximately 80% of stroke patients have some degree of weakness on one side of the body as an initial symptom. In some cases, the weakness may be so subtle initially that the person attributes it to tiredness or having slept in the wrong position. The recovery of muscle strength after a stroke depends directly on how quickly treatment is started. Literally, every minute counts. What would you do if you woke up to find that you can no longer lift an arm or walk normally using one leg? 9. Sensory silence. When half of the body loses sensitivity. Suddenly, you no longer feel touch, temperature, or pain in one part or all of your body. This unilateral sensory loss occurs when somatosensory areas of the brain are deprived of necessary blood flow. Many patients describe the sensation as "my arm is no longer there," or "it's as if half of my body is anesthetized." Numbness can affect the face, arm, and leg on the same side, or just specific parts like fingers, hand, or half of the face. This symptom often accompanies weakness on the same side, but it can occur in isolation in some types of stroke. A simple test involves simultaneously touching both sides of the body. The person with stroke can feel only one side. In some cases, strange sensations such as tingling, burning, or pinpricking precede the complete loss of sensation. The disconnect between what your eyes see and what your body feels creates a deeply disturbing and disorienting experience. Sources close to him confirmed that Pope Francis mentioned altered sensation on his left side hours before he was taken for tests. Sensory loss can include not only touch, but also temperature perception. Patients may not feel hot or cold objects. Neurologists explain that different types of sensitivity, light touch, pressure, temperature, can be affected independently. This symptom is particularly dangerous because it increases the risk of inadvertent injury. The person may burn or injure themselves without realizing it. Sensory recovery often takes longer than motor recovery after a stroke and may persist for months or years. If half of your face or body suddenly lost sensation, how long would you wait before seeking medical help? 10. Interrupted communication. When words no longer make sense. Suddenly, you can't comprehend what other people are saying, as if they were speaking an unknown language. This disturbance in language comprehension, called receptive aphasia, occurs when Wernicke's area of the brain is affected. Unlike the expressive aphasia mentioned earlier, here the problem is not in speaking, but in understanding what is said. To outside observers, the situation is confusing. The person appears to hear normally, but responds completely inappropriately. The patient often doesn't realize there's a problem, creating a frustrating cycle of broken communication with the people around them. In severe cases, even written texts become unintelligible, as if familiar words have been replaced by strange symbols. This difficulty in comprehension often extends beyond verbal language, also affecting the recognition of everyday sounds. The feeling of suddenly not understanding your mother tongue is like waking up in a foreign country without any knowledge of the local language. Reports indicate that Pope Francis has presented moments in which he seemed not to fully process information during important conversations. Approximately 20% of stroke patients have some degree of receptive aphasia during the acute episode. A simple test involves giving simple verbal commands such as touch your nose or close your eyes. The inability to follow these commands is worrying. This symptom is often mistaken for hearing problems or general mental confusion, delaying the correct diagnosis. The recovery of language comprehension after a stroke varies significantly, depending on the extent of brain damage and the speed of treatment. How would you react if, during a normal conversation, familiar words suddenly sounded like a completely unfamiliar language? 11. Uneven breathing. When the rhythm of life changes. Their breathing, normally automatic and imperceptible, suddenly becomes irregular, difficult, or noisy. This frightening symptom occurs when stroke affects areas of the brainstem responsible for controlling the basic breathing rhythm. Abnormal breathing patterns, such as excessively rapid breathing, periods of apnea, or deep, slow breathing may arise. Observers often notice that the breath becomes noisy, or that the person seems to be constantly out of breath. This sign is particularly dangerous because a lack of adequate oxygenation can quickly aggravate brain damage already underway. In severe cases, mechanical ventilation may be required to ensure that the brain receives sufficient oxygen during treatment. The patient may not notice their own respiratory abnormalities. It is often those around them who notice them first. Difficulty breathing during a stroke creates a devastating vicious circle. Less oxygen in the blood means more neurological damage. Sources close to the matter reported that Pope Francis had brief episodes of laborious breathing before seeking medical attention. Respiratory changes are more common in strokes that affect the lower part of the brainstem, known as bulbar strokes. Approximately 15% of stroke patients have some change in the breathing pattern during the acute episode. This symptom is often accompanied by changes in heart rate, blood pressure, and level of consciousness. In the elderly or people with pre-existing cardiopulmonary conditions, this symptom can be easily confused with other causes. What would you do if you noticed someone close to you with irregular breathing, along with other neurological signs like slurred speech? The power of knowledge that transforms moments into salvation. Now you have knowledge that most people will never have access to in such a clear and direct way. Every minute saved in recognizing a stroke can mean millions of neurons preserved and a life transformed. The difference between permanent dependence and complete recovery is often in the first 60 minutes after the first symptoms. Share this information with family, friends, and colleagues. Life-saving knowledge is only valuable when it is disseminated. Memorize the acronym SAMU: Smile, Hug, Music, and Urgency. It helps to quickly identify the main signs of stroke. Always remember that stroke does not discriminate. It can affect people of all ages, genders, and social conditions. Your knowledge is now as powerful a life-saving tool as any piece of equipment in the hands of the best doctors. Always keep in mind that optimal stroke treatment should ideally begin within the first 4 hours after the first symptoms. Get regular screenings, especially if you have risk factors such as hypertension, diabetes, or a family history. Adopt healthy habits such as a balanced diet, regular physical activity, and blood pressure monitoring. Cases like Pope Francis's show that even people with access to the best medical care need watchers around them. The information you have acquired today is not just theoretical knowledge. It is a real power to transform the destiny of human lives. The next time you notice any of these signals in someone close to you, remember, time is brain, and every second counts. What will you do with this knowledge from now on?